Good evening, and welcome to Valley Veterans Forum. In our first program, we discussed the combat-related effects of post-traumatic stress disorder and traumatic brain injury. Tonight, we will look at some of the therapies being employed to treat those veterans who have returned from Operation Enduring Freedom and Operation Iraqi Freedom with these injuries. And we will explore the effect that these injuries are having on the families, spouses, and children of those returning veterans. The goal is to provide veterans with the rehabilitation they need and the resources necessary to help them successfully reintegrate their lives with family, friends, and the communities in which they live. Our first guest tonight is Bart Sherwood. He is the executive director of a nonprofit organization called TADSAW. Bart, please tell us about your program.
Thank you, Steve,
Thank you.
for having me on the Valley Forum. TADSAW, which is an acronym for Train a Dog, Save a Warrior, is a program that's designed to provide for the training of a service dog team according to the ADA guidelines, the Americans with Disabilities Act guidelines, for any wounded warrior, active duty or veteran, surviving with post-traumatic stress disorder, military sexual trauma, and or TBI, traumatic brain injury, in order to restore and improve the quality of their life with a canine battle buddy at no charge to the veteran, participating veteran. The program is designed, like I said, to go ahead and on a one-on-one basis with the veteran and a dog, whether it's a personal a dog or a shelter rescue, for the two of them to go through the program training together, honing their skills and bonding as a team. Some of the effects of PTSD, MST, and the traumatic brain injury is that the veteran loses part of him when he's been deployed. That's self-esteem, self-trust, self-confidence, and finally the control of their life. And with them training their dog and being involved in the program, it gives them back some sense of being as far as completing a new mission. These are professionally trained, the best troops in the world, the best military men, and they go on missions, and when they've come home, something's missing. When they joined up, they got a weapon, they got a uniform, and they were told the person next to them was their battle buddy, and they would have their back. They go through deployment, and they come home, and they take off their uniform, and they're happy to put on shorts and sneakers. They give up their weapon, and that's fine because they probably have a cache of weapons someplace else, and they lose their battle buddy. And for the first time since deployment, they don't have somebody who has their back, their six as it's called. They don't want their family to talk to about things, their wife, their parents, their brothers, their friends, because that's why they went to war, to protect them. And so they bottled this up inside and have no way of getting it out of them. And they go through medications that are not really designed for treatment of post-traumatic stress disorder, but they're looking for something to help bring them back to a sense of well-being and purpose. And because they get to train with the dog from start to finish, they are actually on a new mission to complete and train for. And service dog training is just not a 1 day or 10-week affair. It starts when they start the training, and it continues until that dog is no longer going out with the veteran as his battle buddy, as his service dog. The other thing is that we teach the dogs to be a medical alert service dog by using their natural talent, their sense of smell, to alert the veteran that something's wrong, something has triggered them. through body chemical changes. And it's just not the dog doing it, but it's teaching the veteran to understand what the dog's telling him. When a dog puts their paw on your foot or leans up against your lower leg or paws at you when you're sitting in your couch, the dog is trying to tell you that something is triggering you for a PTSD episode or a flashback. It can't tell you the severity of it or what it is, but they can tell you within minutes after the trigger has occurred that something is wrong. Focus on me. And when the veteran does, he helps ameliorate the effect of the PTSD episode or flashback, where it only becomes a memory or gee, I hadn't thought about that in a long time, a shudder that, oh, that was a cold feeling. It was a memory of something, rather than being pulled into the full effect of a PTSD episode or a flashback where the adrenaline's so high, their heart's pounding, and they think they're right back in the thick of the war. We tell the veterans to go ahead and focus their 5 senses, which is sight, sound, smell, touch, and hearing, on the dog, and taste, on the dog, and that will cause the brain to overload on concentrating on something that everything else kind of just melts away. So it's just not teaching a dog the obedience part for being a service dog. It's teaching the veteran that he's the one that's in charge. He's in control again. And through this program, they restore their self-esteem, their self-trust, their self-confidence, and their control of their life again. And they're able to do things where they won't go shopping with their family, or they won't go to a school program with a child. With their new battle buddy, they're able to go ahead and attend the family meetings, to go shopping with the family, to be part of the family, and just not the family. They're part of their neighborhood, they're part of their community, and they become active citizens again like they were before they went off to war. It's a rewarding experience to really see the change in these men and women when they get paired with a service dog and start the training, and how they are when they finish the training.
Well, Bart, you've sent us a couple of nice videos that demonstrate the success stories that you've achieved.
He's going to try to revive me, and if he can't, he's going to let somebody know.
She's the best thing to happen to our family since I've gotten out of the military.
No more medications, no more hospitalizations, just their dog.
Knowing that they need donations, every congregation can do something.
Jody McCullough is a United Methodist chaplain at Austin Peay State University near the Fort Campbell, Kentucky Army base. She has seen firsthand how soldiers and veterans suffering from PTSD, traumatic brain injury, and other conditions have found life-changing relief with service dogs.
We have a gentleman who had done 2 tours to Iraq and had been injured twice. He has a lot of pain. He was struggling with some very severe post-traumatic stress. And so one of the things that we had heard about were the dogs that help with PTSD.
My name's Chris Crawford. It's my PTSD dog. I got him from Green River Correctional Complex, death row, dogs, hounds to heroes.
We went up with Chris to get Wolfgang, and Chris at that point was still having these serious attacks. The next thing I know, he spots Wolfgang, and he sits down, and he never takes his eyes off Wolfgang. You could just see the change in him as we walked out of that prison. I was floored.
He'll turn my touch lamps on for me. If I'm in a sleep and I'm having a nightmare, he'll come and stick his cold, wet nose in my eye. I've actually sat in a chair and said, boy, my feet are cold, and he's come off the love seat and laid across my feet.
The target command is eventually going to help her learn to turn on the lights and things like that.
I'm Leah with Total Canine Care. I'm the owner and head trainer here, and then I also work for TADSAW, Train a Dog, Save a Warrior. I wanted to provide service dogs to military veterans, as my husband is a veteran also. It was kind of a passion of mine to help some of these wounded warriors that were coming back.
Like sit, hush.
We're all nonprofit, so we work off of donations to cover the training and the expenses of getting the dog vetted.
She'll also learn the cover command. We teach the dog to lean up against him to alleviate that stress of there's a ton of people around me.
My name is retired Sergeant David Cox. I was in the Army 7 years. She's picked up on me a lot. Whenever I start getting angry or upset or I start getting shaky, she does this. She'll come over and she'll rub up against me, or she'll get up on my lap. See that? She is awesome. As a soldier with PTSD, we're in denial. We don't want to think that we're weak. But in all reality, the first step of realizing you have PTSD is admitting to it.
Hi, my name is James Stinson. I was diagnosed with seizure disorder and a TBI injury. I would do what a lot of veterans would call, or a lot of guys in the military call, combat shopping, and that's go in Walmart at 3 o'clock in the morning with a list, boom, 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 and you're out the door. When you're in the military, you go into basic training, you're given a battle buddy. When you go into combat, you're given a battle buddy. I'm out, I don't have a battle buddy. Since I've had OPI, some of the medications I'm off of, and some of them have reduced the medication that I'm using. So, you know, Tadshaw is a great organization that provides a one-time fee for a dog and instead of a lifetime of medication.
My name is Joseph Bays, and I'm actually active duty still. And my dog Charlie is my service dog in training. He's very calming to me. I was watching a show about Afghanistan, and I started crying. He came up and sat in between my legs, and I started hugging him, and he kind of snaps you out of that anxiety phase where you start feeling all closed in, but then you've got him to worry about.
Because programs like Train a Dog, Save a Warrior rely solely on donations, churches can offer support by helping fund service dogs for qualified veterans. Trainers can see if a soldier's own dog meets the criteria, but many times these battle buddies come from shelters, so they too get a new lease on life.
We said, you know, you saved Wolfgang. He was in a kill shelter. You saved him, you know, and he said, yeah, he saved me.
It is the most gratifying feeling I've ever felt in my life. The fact that I saved 2 lives at once is even more gratifying.
For those that would be interested in supporting this program, I mean, it doesn't matter if it's a little bit, if it's a lot. As the veterans, as the wounded, it means the world to us.
The people who donated that money to take care of and train that dog, their ministry is expanding, you know, and they don't even know it.
This video was brought to you by the people of the United Methodist Church through World Service donations.
On a local basis, I'd like to show you a little video that we did with Colin Schmock, one of Tadsaw's local success stories.
Sergeant Colin Schmock is an Army veteran of the Iraq and Afghanistan conflicts. During his last tour in Afghanistan, the Humvee he was driving hit an improvised explosive device. This resulted in serious physical and mental wounds, from which Colin is now attempting to recover.
Tell us a little bit about your service on behalf of our country and how you came to go and do it.
So my mom got me Duke after my family left and everything, and my kids. She wanted me to have a companion, so she found Tadsaw off the internet and told me about it. It took me about a couple months to decide whether I wanted to do it or not, because I had to take responsibility of a dog and if I was mentally ready. And when I got to the point, I went to the VA, got a prescription by my primary physician for me to have him for my TBI and PTSD, and got the letter in July, and by September I had it.
The effects of such traumatic brain injuries and the resulting post-traumatic stress disorders are now much better understood, diagnosed, and treated. One of the effective treatments now being employed is the use of service animals, just like Colin's dog, Duke.
How was it to work with Tadsaw?
Tadsaw was good to work for. Bart is an excellent director. I don't know who's going to fill his shoes when he's gone. He has a real high, outstanding for TBI and underlying combat injuries from being deployed, especially the TBI and the PTSD. And VA doesn't really want to recognize it all the way, but he does, and so he's the one that puts everything out for us and gets everyone certified to have an actual service dog. He helps me through my night terrors. I have night terrors. He'll be there when I wake up. You know, he'll be either nipping on me like he does for fleas, or just barking to help me get through it and wake up to understand that, you know, it's just a dream. He's gotten me out, you know, sociably to be able to talk more. Of course, you know, he's a hot topic to talk about when people see him. You know, he's a very well-mannered dog, and well, still a pup, but
He's a very well-mannered dog, and he's a beautiful dog, too.
yeah. And it just started to help me have more communication skills, so I wasn't, you know, being like a hermit, staying in, out of the shadows, being by myself, and this allowed me to get out. It gives me exercise as well, because I have to take him for walks, of course. And he's helped my anxiety. When I get stressed out, he comes near me, he knows. Like when I was at the VA, and I was getting x-rays done, and they thought I had shrapnel above my hip bone, and I never had shrapnel there. Well, by the third x-ray, I was getting stressed out, and my anxiety was getting high. He came over to me at the x-ray table and started whining to calm me down, and, you know, it helped me out of it. And, you know, there was another time at the VA where there was another veteran who was telling me his story, and he started to express emotions and cry. And Duke started to whine and went up to him like, hey, pet me. And after he pet him, you know, he was able to calm down. Duke is more of a social dog. It's for veterans, I would say. You know, I consider him more as like a community dog. Yeah, I take care of him. I'm his handler, but, you know, his therapy and his help goes to other veterans when I see them. Especially at the VA hospital. When I'm always there, you know, everyone's allowed to touch him, and he likes the attention too.
I'd like to introduce now my second guest, Fred Ramirez from Healing Waters, as he has some questions that he'd like to address to Bart.
Bart, to get our veterans started here in your program, what do they need to do?
They can get on our website and submit a request to, you know, for information, or they can call me directly. Our telephone number 210-643-2901 it's my phone. My background is being a pharmacist, so I always took care of all my customers, and they could call me any time of the day or night. I was always available for them. And I feel the same way about our veterans and wounded warriors. Call me. I'll call you back if it goes to the message machine, you know, that I don't answer because I'm on the other line. But I feel that an organization owes it to the veterans to be personal, one-on-one, and be communicative with them. So if they call me, you know, I'll get information and then send them out the application. This way they know they're dealing with people that care about them, just not a bunch of numbers. So by calling TADSOL, you know, I'll call them back. If they email me, I'll call them to talk to them about the program and discuss it with them. This way I can answer any questions they might have. I guess it's easy to say that since we started this program in 2010, we've probably had over 2,800 applications that I've sent out to veterans and active duty soldiers. And I think I've talked to every one of them. There isn't one that I don't not talk to, because I want them to realize there are people that care in this organization. Can I say one last thing?
Certainly.
You know, 22 looks really good on Roger Penske's NASCAR. 22 looked really good on Emmitt Smith's cowboy uniform, and it looks great on Lance Kershaw's Dodger uniform when he's on his way to winning the Cy Young, you know, for 2013. But when you open up the paper and it says 22 suicides daily by America's veterans, is a shameful number to have to look at on a daily basis. And whatever we can do, whatever program can help to take away those 22 suicides and lower them, is where we all need to be as veteran organizations assisting veterans. And, you know, the VA, when they announced this number of 22, they said they were comfortable with the 22 suicides a day. I don't know how anybody could be comfortable with one suicide a day, let 22. And I think that's what the nation needs to be looking at is how can we help these men and women, these sons and daughters, these mothers and fathers, these fathers and mothers, and, you know, and brothers and sisters to really cut down on the suicide rate, because as an American nation, it's a shameful tragedy.
I agree wholeheartedly. I just passed by a table the other day at the VA hospital where they were handing out brochures on the ACE program, which is supposed to address this. You just can't find a solution by manning a table at a VA hospital and passing out forms. You've got to reach out and touch the right people. Again, Bart, thank you for joining us.
Thank you, Steve. Thank you, Fred.
Thank you.
Welcome back to Valley Veterans Forum. This evening's guests include Remy Sanchez and Fred Ramirez. They're here to tell us the methods they're using to treat post-traumatic stress disorder and TBI. So without further ado, we'll go to Remy.
Thanks for having us.
Why don't you tell us a little bit about the treatment programs that you're using?
Well, it's called cognitive retraining because many of our veterans that are coming home have brain injuries plus PTSD. And cognitive retraining addresses some of those issues that they're having problems with: attention, memory, social skills, those kinds of things. So we work on those skills, and we go into the treatment rooms and we work on skills, and then we provide opportunities outside of the clinic to help generalize these skills and help to reintegrate them back into the community. So with that, we have Fred, who works with Healing Waters, which is fly fishing, but we also do other recreational things like rock climbing, horseback riding, scuba diving, pretty much, or anything that they're wanting to participate in. We'll try to set up for them. The community usually will come forward and volunteer their time and their money. We also have had supporters like Wounded Warrior that will help us with the veterans. So,
you know, I've been out to meet with Guy Adams at Heart of the Horse Ranch recently, and I shot a little pictures there and had a time to visit with him. And I know you've worked with Bart. How's that program worked?
that was probably one of our originals. Aside,
project,
I think
yeah.
we did fly fishing and then the horse ranch. And Guy is great. He his son was a veteran, and so he has been doing equine therapy, and he knows the benefits of it with children with disabilities and so forth. So he contacted me to see if we wanted to go out. I read up on it, and we took the guys out, and it was great. Just being at the horse ranch really helps to relieve some of the stress and the anxiety, so they automatically can relax. We bring the families out too, because they're a big part of the healing process, and it gives everyone a chance to just remember what it's like to just have fun and just to live. And so we get these guys on the horses, and they're learning a new skill. They're able to take the skills not only that they're learning from mental health or some of the other disciplines, but what they're learning with me, and put it in a very functional way. So it's probably that and fly fishing are probably our two most successful programs.
Successful programs we have with the veterans.
And the fly fishing part, I've met people that have been fly fishermen and really enjoy it as a relaxing pastime. How have you seen the results of that?
It's amazing because, you know, you stop and think about when we fly fish, where are we going? Someplace beautiful, someplace serene, quiet. And when the veterans or anybody's out there fly fishing, all they're concentrating on is trying to catch the fish. They're thinking about, okay, what flies do I use? Where's the fish going to be? And like Remy was talking about, the cognitive skills, this is where a lot of that comes into play. You know, they don't hear the sirens. They don't have the spouse, you know, barking orders or telling them to do things. You know, they kind of just, it kind of blocks everything out. You know, they can solve the world's problems when they're out fly fishing. And what's nice is that the guys with PTSD or the TBI, you know, you can see them get better. And people go, well, how can fly fishing do that? Try it once and you'll see, you know, the whole process of it, you enjoying the sport.
That's great. Remy, maybe now you can talk about these psychotherapy aspects of the work you do.
Well, part of that, I kind of, I piggyback on what mental health will do. So a lot of the folks that have brain injuries also have PTSD and so forth. So they're taught coping skills. We work on some of those skills in the clinic, the grounding and some of those kinds of things. But again, it's hard to really get some practice with that or deal with those anxieties unless we go out into the public, into the community where those triggers can happen. So it just gives them a functional place to work on those.
Why don't you tell me a little bit about the impact in the military of the vast changes that have occurred in the last few years, women in the military in particular?
Yeah, we're actually seeing a lot more females, and they're, I'll kind of go back. I think Dr. Kazan, when he was on it, kind of mentioned some folks are predisposed to PTSD. Females are one of those because we're considered minorities. So they're already predisposed to it. A lot of them have histories, and so they that further place them at risk, and then they go out into the military and they experience trauma there or brain injuries or both. And so they're coming back, and they're a unique population. They do well with the male population, but I think we're all recognizing that as females they have certain needs and may feel a little bit safer if we have groups together. So we're really always working on trying to reach out and have a female-only kind of groups, because they face different challenges as far as family and their roles when they return home. So, but there is a huge influx of our females, and I'm sure there will be more coming through.
That leads me to another question. There's been a lot of talk in the media about sexual misbehaviors amongst both genders and the issues that creates post-combat experience.
Yeah, several, unfortunately, several of our females do experience that, and that's kind of why we want to put them together, because sometimes they feel just a little bit safer amongst other females. So that's definitely a part what we would like to do with our group. We've had a group in the past that was all females. They definitely, some of them will participate with our with the other
with our different programs we have.
Programs, because we've created a nice camaraderie there. It's like a family, but there are times where I know, especially if a new veteran coming in, she's a little hesitant, so you know, it would be nice to have that all-female group again.
Fred, do you have anything to add to that?
Well, what's nice with our program with Project Healing Waters is we take men and females. We have 2 women in our program right now, and they fished before when they were younger, but they learned a new skill, you know, learning to fly fish. With our program, we do fly tying, rod building, fly casting, and we try to plan an outing someplace where we travel for 3 or 4 days. And it's nice because, you know, like that old saying, only a veteran knows what another veteran has gone through. So that's what's nice, and what's bringing the women into the program. The guys kind of have to step back and say, well, we have female, but she's a veteran, so they understand where both of them are coming from, and that's kind of nice. They just accept them as a veteran. So that's really neat about what's unique about our program, though.
Good.
And it's all veterans we take. So that makes it nice. Before we had a couple of Vietnam, one World War II, and we call them our boys. We're getting a lot of the younger guys and females coming in to be in our program.
Excellent. Is there anything else you'd like to add to what we've already discussed? Any other problems that I haven't brought up in this discussion that you might want to touch on?
Well, I wanted to kind of piggyback on what Fred was saying. We always say that the veterans, the best healing for them is to get together, because they know what they need to take care of each other. And they've been some of them are at the very beginning, they've just gotten out. Some have been out for 10, 20 years, and they see in each other where they've been, and so they can talk to each other a little bit more than I or Fred could, because we have the theories and we have, you know, all the things that are supposed to make it right, but they can sit together and talk, and I think that's what makes it unique. And the nice thing is that the programs separately have been proven to be very effective. But we're working on getting a grant with Resurrecting Lives, which is another nonprofit, to show the efficacy of this. So we're going to hopefully sometime next year we'll be working on the components of Kongru training with the recreational activities and show how it's proven to help.
Good. So. Well, you've both brought some pictures along with you. And right now, we'd like to look at a few of them, and perhaps you can comment on the various pictures that we've got to show.
This is one of our fly fishing trips that we do every June up to Mono Creek, Edison Lake. And it's nice because it's just the guys. You know, we have our local fly club come up, and they kind of help sponsor the trip, where each veteran has another, you know, non-service guy take them out fishing and just show them the area. And that's what's nice about what we do with our program. They get that one-on-one treatment when they're out fishing. And the guys, a lot of my people in our fly club says, we look at these guys and, you know, there's nothing wrong with them. But it's that silent wound that Remy and I talk about, that PTSD, the TBI, and towards the end of the day, they will see, wow, you know what? We can see it. But if you just look at some of our guys, you know, that so-called normal, they look normal, but it's that hidden wound that what our programs do that help them heal. And that's what's nice. This is one of our camping trips. And what's nice, sometimes the families do come along on the trip. And you know, this gentleman here brought his son. And it was nice because his son has met a lot of the veterans, and all the other veterans treat him like their own child. So that's what's nice.
That's neat. And this looks like Heart of the Horse Ranch.
Yeah, exactly. So you can see all the places we go are very peaceful, very beautiful, very scenic. A lot of the guys are already outdoorsmen. They want to do things. I mean, a lot of them have to do it modified now because they have a lot of pain, chronic pain, but it's nice to take them out and show them that they can still do things. Even if we have to modify it, they can still do things. And again, for their families, it's nice for this particular gentleman that you saw in his family and with his son, because it removes them from all the, the triggers and all the stuff that happens at home. And sometimes, the PTSD and the memory and all these things come out. But when you're over here, you can just enjoy each other and just have fun. So it's nice.
That's great.
It's a really nice guy. Lets the veterans come out, and we usually get together and have a nice barbecue, and he gives them a little mini training on how to ride a horse if they're not familiar with it already. Then they go around, and he's also allows the veterans, if they want to make personal appointments, to go out, and there's trails and other things that they can go on.
But what's nice though too with Guy is that, the guys go out and help him too. He'll make the veterans come out and clean stalls, brush a horse, or move equipment and stuff like that. So, it's nice because they're giving back to him, helping out for what he's doing for the guys.
There's one of your veterans right
there.
there.
Yeah, that's one of our guys. He's this particular veteran. He's an awesome guy. It's so fun to watch him participate in all of these sports. He has such a strong and positive attitude. He has some paresis on one side of his body, but that does not stop him. So it's really fun to see him on the horse ranch. And I'm not sure if we have the picture, but we were able to get him rock climbing. He's done the scuba diving. It's really fun, and he's an inspiration for all of the guys.
A lot of the guys, and he does too. We did the SARS run this fall, and he raced he rode his bicycle in the race. Yeah. And it was nice because a lot of the search and rescue guys came up and he goes, "Wow, this guy's an inspiration."
Yeah.
For a lot of us who don't want to ride bikes, and we see him riding with his disability, he's a go-getter. And that's what's nice. So he's a good inspiration for a lot of our younger guys coming in and seeing where he was and where he is now.
That's one of our female veterans. She had a lot of fun. She's one of our gals, very anxious to go out, but we got her out there and she had a really great time. She loves animals. I think part of the draw of the horse ranch is because it's animals. People are so drawn to animals, and they are very, very healing and calming. So it was a lot of fun to have her come out. She won't do any of the other stuff, but she'll
come out and ride
do the
horses, though, yeah.
Some of your group?
Yeah, some of them. Those were some of my former interns, and one of my gals who's kind of a speech therapist in training. She's from the Young Doctors organization. They take high school students that are interested in the medical field, and they asked to come out and help. You know, they're placed in different medical settings in the hospital. So, yeah.
And what's nice with our programs that we're starting a new nonprofit is that we are doing, adaptive sports. We're doing scuba diving. We're doing rock climbing. We're doing fly fishing. We do the camping. We do the Heart of the Horse Therapy Ranch. We're getting ready to eventually purchase some kayaks for them to do open water kayaking and sailing too.
Oh, wow.
So, and it's nice for these guys we'll find a niche for them. Yeah. We'll find a program that will help them get better, and that's what's nice about what we do is we'll find something for you, even if it's ceramics or
whatever it
or
is,
painting.
we'll figure
but
it
we'll
out.
find something for you that you like you used to do before you served. We'll find something that you can reconnect again to heal yourself.
Exactly, and take your mind off of your past experiences that might not have been.
And we'll try to focus it on something positive.
Exactly.
And that's what's nice, So we're getting there.
Yeah.
That's
We're getting
excellent.
Oh, that was our first trip?
That was our first camping trip. I can't see the picture, but yes. Yeah, we do. What's nice is that we do have fun when we go. And it's nice because at night, the campfire, the veterans come out and they say, wow, this is fun. I remember doing this as a kid.
Yeah.
So, so they're reconnecting with that inner child that we all have, that some of us lose when we get older, but it's nice because, they're getting it back though, and we're healing them.
Exactly. One of the wonderful things about what you're doing is it's non-medicinal. It's not relying on prescription drugs, et cetera, and getting people outdoors, getting people to communicate with not only nature but with their fellow man.
Yes.
And that's going to be the therapy that's going to work in the long run.
Yes, and we're seeing it. We're seeing them progressing, with their the word disability, where you can see them getting away from that. So that's nice.
Yeah, we actually we've been doing this for several years, and we were talking that our first group that has gone through, and like I said, we're kind of like a family, so they always come and touch bases, and they'll come in for what I call booster treatments, and then they'll come to the activities. But we're looking at that first little group, and a lot of them, they're all doing well. They're going to school. They're talking about getting back into the workforce. They're
reconnecting with their families. They're doing the counseling with their spouses, reconnecting with old friends. So that's nice. It's like, one of our veterans that we see a lot, he says, my friends don't understand what I've gone through. Only, my fellow brother, they say, can see. So they're learning how to cope with their friends, trying, to explain, what they've gone through. And that's nice, so, like I said before, I'll keep preaching this. We're healing them.
Yeah.
One at a time, little by little, we're doing it, though.
Excellent. Well, I'd like to thank our guest again for joining us.
Thank you for having us.
Amy Sanchez, Fred Ramirez, and for all of you out there who are watching our program, thank you again. And we'll be back in touch with another program soon.